cases continue to rise. Governor Brian Kemp is holding a press briefing right now. Let's listen in.
As you all know, life has drastically changed over the past weeks here in our state, across our country, and certainly across the world. Our Georgia children are now at home. Many Georgians are working remotely. Our public gatherings are few and far between, and that's for a very good reason. Some health care facilities, including Georgia hospitals, are ramping up their capacity as they see more and more patients and are providing critical treatment to those that are in need. Leaders at the federal, state, and local level are working hard to make the right calls at the right time to keep our citizens safe. I will tell you there are no easy answers, and the guidance continues to change as we fight to stop the spread of COVID-19. Moving forward, we must remain dynamic and responsive. To weather this storm, we have to stay united in the fight, and Georgians deserve to have the facts to make the right decisions for their families. They need as much information as possible to keep their loved ones safe. Yesterday, there were 197 cases of COVID-19 in Georgia, spanning 29 counties with 3 confirmed deaths. Today, there are 287 cases of COVID-19 spanning 36 counties. That now includes Bibb, Early, Glenn, Lawrence, Muskogee, and Peach that previously had no cases. We are actively investigating confirmed cases in certain long-term care facilities, which, as you all realize, presents a unique and time-sensitive challenge. So far, the Department of Health State Lab has conducted 508 tests for COVID-19 with 113 positive results. State officials have deployed mobile testing sites in certain regions of Georgia, and there's more that are on the way. The commercial labs have conducted over 1,300 tests for COVID-19 with 174 positive results. Due to the volume, some of the commercial tests are taking longer than the standard 48 hours to get the results back, and I'm certainly urging those labs to continue in a timely fashion as we go forward. This morning I was encouraged by the news from the White House that vaccine development and antiviral therapies are moving along quicker than originally expected. Certainly applaud the Trump administration's leadership in removing unnecessary red tape and outdated rules to deliver real solutions for American families in this crisis. Even with these developments, we must start to prioritize COVID-19 tests for our most vulnerable populations, as well as the people responsible for care and safety. This action will conserve precious medical supplies like masks, shoes, covers, and gowns, which are becoming increasingly difficult to find due to overuse, export banning, and hoarding. Health officials on the state and national level urge the public's immediate cooperation with this. Georgia's elderly, those with chronic underlying health conditions, those who live in long-term care facilities like assisted living facilities or nursing home facilities, and those serving on the front lines as a health care worker, first responder, long-term care facility staffer, or law enforcement need those tests. The best way to serve the public is protect those who are protecting us. As many of you know, I recently declared a public health state of emergency in our state and authorized GEMA to work with the Georgia National Guard to activate up to 2,000 troops to assist in emergency preparedness and response efforts as needed. On Monday, the Georgia General Assembly convened for a special session to ratify the public health state of emergency. I'm very grateful to the House and Senate for taking swift action so that we can deploy all necessary resources to help our fellow Georgians in this time of need. We also continue to update the appropriation chairman in both houses on how we plan to use the emergency spending in the amended budget. Unlike other states of emergency, this declaration allows the Department of Public Health to direct specific health care action in these extraordinary circumstances. We are moving forward using the advice of health officials and emergency management officials at all levels of government. Already we have learned of looming supply shortages at specific hospitals in Georgia. I want you to know that we have taken immediate action, working with federal officials to secure more tests as well as critically needed materials from the national stockpile. We are coordinating supply delivery to healthcare facilities that are in need, and we are certainly grateful for all of those who have offered up their inventory to help others. Your sacrifice is literally saving lives. Earlier today, the Centers for Medicare and Medicaid Services issued new guidance to the American healthcare workforce, asking for a delay in elective procedures to conserve medical supplies and to free up medical staff. The Georgia Department of Public Health, the Georgia Emergency Management Agency, and I urge all health facilities to follow this guidance as well. There is no doubt that without a question we are going to need these resources in the days and weeks ahead. As the number of Georgia cases continues to rise in communities across Georgia, hospital bed space continues to remain a serious issue for us all. State agencies are working in tandem to determine the existing capacity and run the numbers on potential needs. This work is ongoing, and we will continue to provide updates as this situation changes. Fortunately, we continue to receive offers from the private sector, including great companies like Walmart, the Atlanta Motor Speedway, UPS, and others, to name a few, to utilize private real estate and other resources should the need arise. We are grateful for that offer. At the Georgia Public Safety and Training Center in Forsyth, Georgia, GEMA has almost completed installation of a new patient isolation zone that will be ready for emergency housing units. Hard labor at Creek State Park is still an asset to our disposal, with 7 trailers on site if patients with COVID-19 have no alternative housing during the recovery. We have 1 person there today. In accordance with public health state of emergency that I declared, all elementary, secondary, and post-secondary public schools closed yesterday on March 18th. That will go through March 31st. In many circumstances, online learning will continue, and both the University System of Georgia and the Technical College System of Georgia have moved to online learning for students through the end of this semester. On a case-by-case basis, school officials are working to accommodate students who require in-person clinical experience to complete their coursework. As you can imagine, many of these individuals are needed on the front line of this healthcare fight. I wanted to also address something that sadly is true. Misinformation is certainly rampant in times of crisis. I want to thank all of the Georgians out there who have alerted my office to potential scams. We are working very hard to keep people apprised of what we discover, and I encourage people to continue to rely only on official sources for information. If you see something suspicious or hear about it, please let us know. Part of our response includes a new COVID-19 hotline for all Georgians. On average, our team has been receiving 700 to 800 calls each day to share public health information and to connect people with the resources that we have available for assistance. I'd like to give you that number now. 1-800-442-2681. Again, that's 1-844-442-2681. Right now, we have 209 passengers from the Grand Princess cruise ship remaining at Dobbins Air Force Base Reserve. Officials are making plans to get people home to their states when they can be safely returned. As you know, we had up to 487 people there at one time. As you can imagine, as a husband and father of 3 girls, I understand the concerns and the fears by people across our great state. Despite all of the unknowns, know that we are working to prepare for and respond to any scenario. Our top priority is the safety of our citizens in every corner of this state. As we work to flatten the curve and keep communities safe, we are certainly mindful of all of our small businesses that are affected by this crisis. They are the lifeblood of local communities and employ millions of hard-working Georgians. As a small business person for over 3 decades, I've known firsthand the stress and strain this pandemic has caused on Georgia entrepreneurs and job creators. I'm proud to report that yesterday the U.S. Small Business Administration processed Georgia's paperwork to allow small business owners to apply directly for economic injury loans. This application is now available online directly through the SBA. To stop the spread of coronavirus, we must follow the guidance that we have been receiving from federal and state health organizations as well as the leaders. Regularly wash your hands. Practice social distancing. Go at all costs and protect the elderly and chronically ill and get them to stay at home, especially if you are sick. If you're experiencing symptoms consistent with COVID-19, I want to urge you to call your doctor or urgent care clinic. Do not show up at an emergency room or your doctor's office unannounced. I would ask you to remain calm, act responsibly, and help us urge your fellow Georgians to follow the medical recommendations that we are giving. Right now, I'm not mandating business closures, shutting down public events, or forcing people into quarantine. I am, however, leaning on the advice of medical professionals and scientists, as well as urging local officials to do what is in their best interest and the best interest of their communities to keep their communities safe and stop the spread of coronavirus. We are all in this fight together, and together we will emerge stronger than ever. I would like you to all continue to pray for our men and women in law enforcement, our first responders, and the health care providers across the state who are doing everything in their power to keep us out of harm's way and literally save lives around our state. To all of the business owners who stepped up to offer assistance, who had to make tough decisions for the greater good, the future may seem uncertain, but know that we stand with you. With that, I'm going to run through some questions that we've received from the media, and at the conclusion of that, I'll see if we have any more that have come to us during my remarks. The first question is thoughts about a statewide mandatory quarantine. At this time, I do not plan to issue a statewide mandatory quarantine. I continue to call on locals to take the appropriate action for their communities. I can tell you that I've been in touch with the community leaders in many of the hot spots that we have seen around the state, asking them what they need, if they needed me to act, and at this time, they are telling me that their communities are stepping up, they're following the guidelines and the advice that we're giving them, and that is making a real difference. And they are saying, do not do this at this time. The second question is, would there be a no payment policy for government-run utilities to help the population not pay or discount on utilities? I will tell you that some companies have enacted these policies to temporarily halt disruption in service due to non-payment, but it depends on that company. The third question is, when are you going to mandate the shutdown of bars, restaurants, and citywide shutdowns like San Francisco and New York to prevent the spread, and why the delay? At this time, I do not plan on forcing businesses to close. If the circumstances change, I will take the appropriate action. For now, I believe that most Georgians are heeding the advice of health officials and medical providers. Our decisions will continue to be based on the facts and the expert advice that we're getting from health care providers and folks like Dr. Toomey and the Georgia Department of Public Health. The next question is, how can we help health care workers who have children? Parents can search for child care on the Department of Early Care and Learning's website, www.qualityrated.org. That's www.qualityrated.org. I want to commend Amy Jacobs and her team at DECAL for this great work that they have been doing. Parents can search by location to see what's open nearby, or they can call 1-877-ALL-GA-KIDS. That's 1-877-ALL-GA-KIDS, and speak to a child care expert. As of this morning, 916 child care programs are open, and over 1,100 are now closed in Georgia. Yesterday, we put out a press release applauding the YMCA of Metro Atlanta for offering child care for health care workers. This is quite an amazing thing that's been put together. I will let you know that the Y is already at capacity, so we are directing parents to the Department of Early Care and Learning for more direct assistance. The state, as I mentioned earlier, is now reporting 10 deaths. Which counties are they from? This is another question. The counties are as follows: Early County 1, Fayette County 1, Dougherty County 4, Floyd, Fulton have 2 each, and Cobb County has 1. The next question is, many people are upset that a state senator went to the Capitol earlier this week when he's showing symptoms consistent with COVID-19. Can the governor speak to the senator's decision and what precautions he might be taking? I would just say that this is a good example of why we need people to follow our advice, follow the advice of their medical provider. Stay home if you are sick. If there's any doubt, stay home. We've had this happen in many places around the state with sick individuals attending funerals, which has created one of the hot spots that we have around the state. And I think this is a good example that we can all learn from. The next question is, the governor suspending the state's certificate of need law and to give nurse practitioners freer rein to respond to the crisis? I will tell you that this time that we are reviewing both of these proposals with our legal team, and we will continue to keep the public updated if we decide to move forward with that. The next question is, how many doctors and nurses have tested positive for the virus so far? We do not track positive cases by profession. The next question is, how can private labs apply to the state for reimbursement? At this time, the state lab is conducting its own test, and private companies are acting independently. I will tell people, as we mentioned earlier, we're asking to save the test for the frontline healthcare workers, the elderly, the medically fragile, and the other folks that are priority, and this is coming directly from the CDC's advice so that we can test the people that are on the front lines of keeping us safe in our hospitals and medical facilities. I would caution Georgians that want to get tested, if they're trying to do that through a private site, to make sure you are vetting that site. If you have any questions, please call our 1-800 number for advice on whether you should be tested, and if you're going to do that, where that would be available to the private sector. The next question is, will the state place orders such as curfew or a shelter-in-place order? As I've mentioned before, that is not under consideration at this time. I want to continue to urge Georgians to follow the directives that we have given. Avoid large gatherings, practice social distancing, and make sure that you stay home if you are sick. Continue to wash your hands and wipe down surfaces that others may be exposed to. The next question is, how will the new drugs approved by FDA be distributed to Georgians? As you can imagine, we are working very closely with our federal counterparts on this and many other things, and we'll keep you updated on plans for distribution when this becomes a reality. The next question is, a number of businesses in my area are asking if the governor can do something about tomorrow's sales tax deadline, March 20th. The March 20th is the deadline for businesses to pay their February sales taxes. I'll tell you that our Economic Impact Committee of the Coronavirus Task Force is actively researching this option and many others, but at this time there are no plans to delay the payments for tomorrow. The next question is, restaurants in my area want to know if the governor has the power to waive rules on alcohol sales coming out of the door. They have a large amount of alcohol they cannot sell with the closure of dine-in sales, and they also need the cash flow. I will tell you that we are continuing to work with the hospitality industry to look into this possibility as other things that they are trying to work with us on to help them in this great time of need. As you can imagine, that is an industry in our state with many others that have been severely affected very quickly by these happenings. The next question is, does the governor have a message to houses of worship for this week's service? While many in Atlanta are not meeting, we are seeing a significant number of churches and other religious organizations holding services in rural Georgia. I would urge people to please consider moving those services online. We have seen several instances around the state where members of congregations have been affected, and before they know it, they are spreading that in their local community. I know firsthand what a tough call that is. My church has experienced the same, moving from not electing to do that last Sunday, but moving to completely online this Sunday. I know many people have differing opinions on that. I'm very sympathetic to it, but I will tell you that there are real-world solutions, that are real-world problems that have happened out of infected people going to these services and helping spread and create hot spots around our state. So I would ask those religious leaders to pray deeply and to consider holding services online or delaying those services. The next question is, I'm interested in hearing the latest on the regional test sites that the state is working with FEMA to set up. Are those close to being ready? Yes, they are. Those lists are underway. We'll be announcing that as soon as we can, but I can tell you that those facilities are being stood up right now. There was some soft testing that began yesterday to make sure we have the process and the procedures down, and we'll continue to share that information with the public as soon as it becomes available. The next question is, what is my message to Georgians who are worried about making ends meet because they've been laid off or lost hours at work because of the crisis? I can tell you that here in Georgia, we continue to work with the Labor Commissioner Mark Butler and his department to issue guidance and help people in this difficult time. I know from my call today with the President and the Vice President and the nation's governors that they are continuing to follow this issue very closely, especially industries that have been adversely affected when you think about the state of Georgia, the airline industry, hospitality industry.
And that is the latest now from Georgia Governor Brian Kemp giving the update on the state's response to COVID-19.